Good afternoon, everyone. Prime Minister, the Honorable Mia Amor Mottley, and the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, will address the nation. Minister Bostic will begin.
Thank you very much, Lisa. Good afternoon, all. I start my remarks by informing you of the untimely passing of another COVID-19 patient, a 50-year-old Barbadian male who would have been at Harrison Point from the 28th of August and was intubated last night and unfortunately passed away this morning. I extend the condolences of the Prime Minister and the government of Barbados and all those of us who are dealing with this COVID matter to the family and the friends of the deceased. May he rest in peace. I will start today by giving you the stats for today. 1,686 tests were conducted at the Best Dos Santos lab, resulting in 96 new positive cases. 96 cases, 90 of those had Barbadian identification numbers. Of the 96, 22 are under the age of 18, and this brings our figures to 310 persons under the age of 18 that have tested positive since the 1st of September. This, of course, is a worrying trend. The numbers are increasing, and they range. One day we had about 6 positives, and we went as high as 30 positives. And for me, this is a clear indication that I need to appeal to parents and guardians and families of our young ones that we have to really do our very best to protect them. For those who can be administered the vaccine, those between the ages of 12 and 18, I would encourage and recommend that you do everything possible to facilitate this. And for those who are unable to take the vaccine at this time because of their age, we have to go the extra mile to make sure that we ourselves are vaccinated. And if we are not, that we take all of the other public health measures very seriously and that we strive to protect our young and loved ones. The figures today represent 14 families that have been impacted. 14 families ranging from 2 to 7 persons. And this brings the tally from the 1st of August to 142 families. 142 families. And today's positives also come from about 14 communities across the southern half of the island. As we've been saying before, this is where we are seeing the concentration, particularly along the urban corridor. Regrettably, we have now a total of 58 persons that have died from COVID. And for us, this is a concern. It's a concern because we are trying desperately to protect lives, to save lives. And even though we've had about 6 within the past week, for us it's 6 too many. And I want to say that given the state of play and what is happening across the globe, the impact of the Delta variant, this is something that we must expect. We must expect that regrettably there will be some deaths. But I believe strongly that if we do all of the things that are necessary to help us in this situation, that we can save lives. And the best way for us to be able to do so is by taking the vaccine. Unfortunately, all 6 persons who have died within the last week have been unvaccinated. So let's look at what it is that we are dealing with at this point in time. And although I will mention some of the figures, I don't want this to be about figures today, because the reality is we have widespread community transmission and we are impacted by the Delta variant. The numbers are high, but I would say by the grace of God and the work of the teams in the field doing the contact tracing, and at Harrison Point, dealing with the positive cases and the mitigation measures that we have implemented, it could have been worse, and the vaccines have played a significant role so far. It could have been worse. But it can get worse. And let me say that because that is the way that this has been going across the globe. But we can do something about it by taking the vaccines and encouraging our loved ones and our friends to take the vaccines. So that we would have seen over the last several weeks, the figures, the 7-day cumulative incidents, the 14 and the 28. We would have seen the 14-day climbing to as high as the 28, 589 per 100,000 of population. The 14-day, 383 per 100,000. And the 7-day, 207 per 100,000. And as I attempted to say during the last press conference, even though it looks like it is declining as we move from 28 down to 7 days, we are far from out of trouble. We are far from out of trouble. So that these figures represent the spread, but it is not about figures at this point in time, in my humble opinion. It is about our capacity to respond to the situation that confronts us. Our capacity in quarantine, our capacity in isolation facilities, and our capacity in terms of human resources. And I can say to you that yes, we are challenged, but we can overcome the challenge. But the most significant challenge at this point in time is in terms of human resources. And we've been doing a lot to ensure that we provide the personnel required at all levels and in all areas of this operation to be able to deal with COVID-19 and the variant. I say to you that the government has been taking a lot of measures and introducing a lot of things, and I'm sure that the Honorable Prime Minister will speak to some of these today. But this is not a one-sided affair, and it is not a one-sided fight. We need everyone to come on board, and we've been saying this all the time, and I'm going to repeat this every time I come here to speak to you, because it is the truth. It is what is required. It is what must happen if we are to overcome the challenges. And I will say something to you in relation to isolation. We are very lucky in this country. We have more resources than most, and I would say more resources even per capita than most. We have an isolation facility that is separate from the main hospital. We have a cadre of clinicians and paramedical personnel at Harrison Point and the other isolation facilities, second to none. And that is not, I'm not boasting, I'm telling you exactly as it is. And that is why we have been able to contain the spread of this virus as it relates even to the variant, the Delta variant. But there's a matter that I want to speak to this evening, because this one for me hurts. I have been the subject of some memes for the last several months, and I have never even responded to one. In fact, in some instances, I found it to be amusing, and I smile, but I've never responded. And why? Because I'm supposed to be able to take anything that comes my way, and I do. But if you're coming from my background, then you know that all persons under my responsibility, I take very seriously. And if you trouble them, it is even worse to me than troubling me. And what am I talking about? When we first started this journey, there were several persons in this country that did not even want to go anywhere near anything that said COVID. But we had some professionals, mostly from the Queen Elizabeth Hospital, who decided early on that they were going to go on the front line. There we're going to man the isolation facilities starting at Amor and then moving on to Blackman Gollop and finally Harrison Point and now to the others that we have on stream. And they have been providing human service to the people of this country. I know because I visited them on several occasions. They work tirelessly, ably led by Dr. Corey Ford. In fact, Dr. Ford himself has an international reputation because I sit on some bodies, international and regional, that I know this. These people have been given their all to Barbados. And I salute today all of the frontline workers and all of the essential workers. And these workers come from across government and from across sectors, private and public. But there's something called the tip of the spear. The tip of the spear would include those persons who are at the front of the front line. And I'm speaking specifically to those at Harrison Point. And they have saved several lives. There are thousands of persons who've been to Harrison Point and have spoken highly, not only of the environment and the facilities, but the level of service that has been administered. And I'm talking about visitors as well as locals. And so today, I salute all those who've been at Harrison Point as positive cases and came out and decided that they would give back. They wanted to present things to the people at Harrison Point because they appreciated the treatment that they got. I salute you. I salute the companies in Barbados, and there are many who have contributed things, resources, much needed resources to the folks at Harrison Point and the other isolation facilities. Today, I salute you. I salute you. But we've seen something in recent times. We've seen something in recent times where on social media, there are some people who are trying their best to destroy the reputations of the persons at Harrison Point. And all kinds of things are being said that really I find disgusting and hurtful, and I must admit that. In fact, I find some of the comments and some of the things that are being said to be toxic. Toxic. Yes, toxic. And I want to say to all Barbadians and reassure you that for every one negative comment that you will see on social media about the quality of the service at Harrison Point, there are about 10 or 15 letters or emails that we receive from persons here and abroad, visitors who have been at the facility, and all of these persons have spoken very highly of the quality of service at Harrison Point. And so it is my duty and responsibility to say to my staff at Harrison Point, have no fear. You have the full support of the Minister and staff at the Ministry of Health and Wellness and the Prime Minister and the government and people of Barbados. And we urge you not to weary at all in this fight. Understand that we are here with you, we believe in you, we appreciate everything that you are doing, and we are supporting you to continue to do what you are doing. I'm not going to appeal to those who are making the comments, because I know that the majority of Barbadians do not believe in those things. And so I urge my fellow Barbadians to resent that kind of information when it comes to you. Do not forward it. And please send some love and some kind greetings to the staff at Harrison Point, because they are working and operating on your behalf and on the behalf of this nation. That is my plea today. And if we do this, and they continue to do what they're doing, and the Prime Minister will make a few announcements here today, we will get out of this. This is nothing that is beyond us. But what we don't want is for persons to try to malign the character of the people working at Harrison Point. Harrison Point, isolation facilities, quarantine facilities, the lab, wherever you are in our hospitals, psychiatric, geriatric, Queen Elizabeth, we salute you today. Thank you.
Thank you very much, Minister Bostic. The Prime Minister will now address the nation.
Thank you very much, Jeffrey. And I really want to salute you for those remarks. I think they were timely, they were apt, and certainly as I speak with you today, I will want to reinforce and associate myself with those words. Indeed, I could not have expressed them better or stronger than you did, and that is why you remain for me the person who is in charge of this battle day to day. My people, I am getting ready to attend a series of meetings out of Barbados next week, including, as you would know, our participation in the United Nations General Assembly. And there are a host of other meetings before that I'll speak to. But there were a few matters on my mind that I really want to talk to you about today. Firstly, I want to say how happy and blessed I feel to see larger numbers of persons coming out this past week to be vaccinated. Believe you me, we are trending in the right direction. But the overall rate does need still some pumping up. It's still a little bit too low. I'm going to the United States of America, where in excess of 75% of the population has been inoculated. And yes, it is true that we've had to pause because we didn't have the ready access to vaccines as we would have liked throughout the entire period. But we are now in good shape, and we hope that those supplies that are also due to come will come shortly. But the general ballpark that I'm seeking is because we can do a lot more things if we can increase our inoculation and ensure that more persons are vaccinated. Indeed, I can see gradually a reduction in the hours of curfew. I can see the range of activities for public engagement being increased. All of these things are natural consequences. And as I go further today, we'll talk a little more about what is potentially possible. But as I said at the outset, I want to congratulate the Minister and the staff of the Ministry of Health and Wellness. Believe you me, I know we have had our rough moments as a nation over the past 2 weeks. And I know it continues to be rough and challenging, as Jeffrey said. But I think overall today, the service that we collectively offer to the public has generally been made better. And from the very beginning, a few weeks ago, I told you this is not a sprint. This is a marathon. And it therefore means our attitude and the things that we do in addressing what we must address has to be different. We recognize, for example, that the battle now is clearly in our communities and in our houses. We heard just now the number of families that have been affected since the 1st of September. It means, my friends, that we have to keep our guard up. And we have to keep our guard up when we least expect to have our guard up, with our families and in our households. We have to be faithful to the protocols. And even if we're vaccinated, the masking, the sanitizing, and the physical distancing where possible, especially outside of our immediate bubble. I expect that in your bubble there will be a level of comfort, but even then, if you know that the persons in your bubble work in a job that is intensely active and that you have to deal with a lot of people, let us pause and even ask them to do so. On Monday night, in meeting with some of the public health nurses, there was one gentleman who clearly pointed out to us that when he comes home at night, his mother is elderly, and he goes straight to his room, straight to bathe, and straight to ensure that he can keep his mask on, because he does not want working in a high risk job to put his mother at risk in any way whatsoever. This discussion has to become basic in every household. And that is why we are asking Barbadians, wherever you are, to help us carry the message, but also to help reflect on the fact that 125,000 people have already taken at least one jab. And I've maintained that these numbers are in fact excellent for us, because as a small nation state, we have one of the highest percentages of persons vaccinated globally, but we know we can do better. Barbados, my friends, is one of the few in the region that is clearly working towards ensuring that we carry vaccines to people. And there has been a clear and visible difference that has been made by the community pop-up vaccines. Last week, in Bushall, as I said, on Sunday, I saw people stand up in the middle of rain. Heavy, heavy rain, where we had some flooding further down in the community. And they waited because they wanted to be vaccinated to protect themselves, knowing full well that that vaccination, in addition to the other things like masking, like sanitizing, like physical distancing, will give them a level of protection that will make them feel better about going about their business on a daily basis. As I said just now, Barbados is one of the few countries, if not the only one, that is doing these community pop-up vaccines in the Eastern and Southern Caribbean. We need to continue. On Monday night, we met with the public health nurses, representatives of them, for almost 4 hours to be able to see how we can even increase from the 2 communities that we were doing daily to see if we can go close to 5 or 6. We've also had some private sector entities reach out to us asking if they can be the location for some of the community pop-ups. And I know therefore that the persons in charge of the administration of vaccines are in fact engaging with them now to see how that will go. I was also advised this morning that the training for the private medical doctors will start tomorrow with respect to their ability to administer the vaccines, as I indicated, was part of our rollout policy as a government. So my friends, I want to thank, on behalf of the government and people of Barbados, as Jeffrey just did, the doctors and the public health nurses and all of the medical personnel and orderlies and other persons working to support the medical personnel for going the extra mile in this country. Not only do we not take your services for granted, your commitment for granted, but we want to specifically remind Barbadians of how grateful we are to you for going that extra mile each and every time. And I say so, my friends, Barbadians, because I know how hurt many of them were yesterday as a result of the matters that Jeffrey spoke about, the unfortunate attacks that have been made on their integrity. And it cannot be good if you're working 12 and 14 hours a day to have people question your motives and question your integrity in circumstances where the evidence is there for all to see that the majority of people, thousands of people, over 6,000 people in Barbados have had COVID. We've been able to limit it to 58 deaths. Believe you me, my friends, it is 58 deaths too many. The 6 deaths this week is 6 deaths too many. But we have been able to limit it in a way that other countries have not been able to do. And I say so now, not as an act of boasting, but as an act of reality. Those policy decisions, combined with the commitment of the medical personnel, the doctors, the nurses, the orderlies, the people who clean, all of those people that we've just spoken, it is the combination of the two that has allowed us to see one of the lowest death rates in the world. And we need to celebrate that even as we commiserate and reflect on those who have left us regrettably. I want us to do that, my people, because it is critical that we remain together in this battle. And if you have never listened before to that plea, I ask you to listen today. Because the bottom line is that Guyana, for example, has 2.5 times our population, but the number of deaths in Guyana are more than 12 times that in Barbados. Jamaica has 10 times our population, but the number of deaths, regrettably, are more than 30 times ours. Trinidad has 4 to 5 times our population, but the number of deaths, regrettably, are in excess of 28 times ours, 27 times ours. In the Eastern Caribbean, a number of countries are much smaller than us, but the death toll in some countries is in excess, more than twice what it is in ours, and in other cases, the same as ours, in spite of the fact that the populations are a quarter the size of ours. I do this not to do anything else, my friends, today, to let us appreciate that the road and the policy decisions and the commitment that we have seen from our medical and health personnel are all in the right direction. We're this close, believe you me, but we need to make it to the end. And in order to make and close the distance, we need the people of Barbados to help us. Last night, Mr. David Ellis spoke to the people of this nation on CBC television, basically making the same point, that we've done well, that we have over 50%, as I said, of the adults who have been vaccinated. We now have just under 7,000 of persons under 18 vaccinated. But we can do better if we boost our numbers bit by bit. But before I get to that, I also want to remind us of the cost of what it is we're doing. And in respect of that, it is not easy, my friends, to house or to sustain the housing of over 800 people as we have been doing institutionally. Last week, as I said, when I met with colleague prime ministers and heads of government meeting, those numbers that I just discussed were clearly before us all. And the reality is that many of them, like us, are finding this a challenging situation. But Barbados is doing much better than most only because of some of these policy interventions, along with the dedicated facilities and the dedicated personnel that we have. And we thank the Cubans and we thank the Ghanaians, because without them we would not be able to mount the response that we've mounted. So we are fortunate in a very, very, very key way. But I want to remind us that it is also because of decisions that we took, difficult decisions that we took 3 years ago. And what am I speaking about? Prior to January 2020, we were in what we considered the battle of our life with respect to the restructuring of this economy and with respect to trying to reverse us from being the third most indebted country in the world. We restructured our domestic debt, we restructured our external debt. Regrettably, just over 1,000 persons were laid off, and we had to make hard decisions, and we had to increase taxes and rates in some instances, while at the same time using the opportunity to fix a number of things that needed to be fixed. We had to stop sewage from flowing in the roads. We had to get back buses so that people could get to work on time generally in this country. We had to start collecting people's garbage on a regular basis again. We had to do a whole host of things. And all of that was before January 2020. Since January 2020, in spite of being in an IMF program, in spite of having to restructure debt, we have now faced three things that any one of the three, in combination with what we were doing with the IMF program and the debt restructuring, would have caused people to get more gray hair than you want. And what am I speaking about? One, the worst hurricane in 66 years. Two, the worst ashfall in 119 years, costing us the equivalent of 1% of GDP in losses. That is in excess of $85 million in losses. And of course, my friends, the worst pandemic that the world has seen in 102 years. Any one of those three events, on top of what we were doing when we came into office in terms of stabilizing this economy, would cause other people to literally either surrender or be the victim of serious heart attack and indigestion as you try to solve it. And I want to say to you today that I am very grateful for the cooperation of the social partnership of this country and the people of Barbados. For in the same way we met those challenges in the first 18 months, we literally are meeting these. Were it not for the guidance and advice of our advisory team, we would today be forced to make very hard and painful decisions with respect to the management of COVID and with respect to the oversight of other vital aspects of our social and other healthcare services. We would not be in a position to have a Harrison's Point as a separate facility. We would not be in a position to have the kind of dedicated facilities that we've put in place for vaccinations or testing, or to be able to purchase the amount of tests that we've purchased, to do the kind of vast initiatives that we've done, like Operation Seek and Save, or by providing packages, care packages for over 85,000 Barbadian households. We are fortunate, my friends, to have had the services of advisors like White Oak, who helped us restructure our debt such that 1 month before the start of COVID, we had completed the domestic and the international restructuring of our debt. We were fortunate as well to have benefit of advisors like Dr. Kevin Greenidge and Professor Avinash Prasad and Dr. Clyde Maskell and Mr. Justin Ram in more recent times to help us be able to ensure that the kind of fiscal space and the economic decisions that we have to take to get us through this situation we can do. Our foreign reserves are at $2.9 billion, $2.912 billion this week. That is in excess, my friends, of more than 30 weeks of import cover. It is the healthiest it has been. And for those who say, yes, a lot of that is borrowed, I say, show me who was able to borrow money before May 2018. We could not borrow a yen. We could not borrow a cent, and that is why we had to print money. And the bottom line is that we can do these things because those advisors and the social partnership and the people of Barbados work together to allow us to construct a situation that allows us the freedom to fight this pandemic and to deal with the hurricane and to deal with the ashfall in a way that others are having difficulty to pay salaries in this region as we speak today. My friends, this has not been an easy journey, but it is a journey that has been literally worth it because the resilience, the determination, the persistence, and the sacrifice shown by Barbadian people, buttressed by advisors, because we don't have in the government all of the services and skills that we need. Let us be clear. And it is against that background that I really am so upset earlier this week by the vilification and attempted demonization of Mr. David Ellis, the person who we have asked to be an advisor on COVID communications and in the public interest. Not an advisor to the government, but an advisor to all Barbados. Mr. Ellis is arguably the best in his field. He has been the communications expert in this country for over 40 years. But because now he has chosen to deal and join with a national crusade, no less national than the crusade to save our economy, no less national than the efforts of the social partnership and other Barbadians in helping us to restructure our debt and to deal with our economy, all of a sudden he is partisan, he is political, he has sold out. That is absolute errant nonsense. Can you say that the leader of the opposition or that the leader of the Democratic Labour Party has sold out when we meet with them? Of course not. And mercifully, the leader of the opposition and I meet on occasion on matters of national import, and that does not stop him from criticizing the government as he should when he needs to, nor does it stop us from responding to him as we should when we need to. And similarly with the leader of the Democratic Labour Party. But if we believe that every person who wants to say or to come and join a national crusade is now a sellout, then, my friends, Barbados is going down a very slippery slope if it begins this habit of demonizing all who step forward to serve or all who are recruited to serve. This is not the country that would have led to people of different sides working together to ensure that we could get Sir George Allen elected as the Director General of PAHO. This is not the country that saw a sitting Democratic Labour Party government express no objection to the appointment of Liz Thompson as an Assistant Secretary General of the United Nations. This is not the country then that would have seen an Owen Arthur 6 months after Hartley Henry ran against the Barbados Labour Party, recommending Hartley Henry to the people in British Virgin Islands and Anguilla as a political consultant worthy of their engagement. My friends, I could go on and on and on. I was the one who literally met with David Thompson to discuss how we would deal with the replacement of the Privy Council as our final court of appeal. And we agreed that the country could not benefit from a divisive or a partisan approach with respect to the establishment of the Caribbean Court of Justice as our final court of appeal. And I thank him, even wherever he is now, looking down on us, and remind him that that is the approach that we understood as people come into public life. That is in the best interest of our country, because on 166 square miles, there is no place to run. This is the country that has also exported skills and services to the rest of the world. And I speak to this because I want to speak also of the creeping influence of xenophobia, or this thing about abusing foreigners who are here. We have to do better. And I say so from my heart, because I'm conscious that I'm closer to the end of my public career than I am to the beginning. And it bothers me that if we're not careful, we're not going to be able to find people who want to serve because they cannot deal with the demonization. You heard Jeffrey in his moment just now in his speech refer to the fact that he has been a victim of memes. Well, I don't need to tell you that I have been a victim of memes, because I don't think there's anybody who has been more a victim of talk and Movelang and Calypso and memes and all kind of salacious political mythology than I have been. But I've stayed focused, and I've ensured that when it happens, that we try to make sure that those who are not accustomed to it and who don't have the tolerance for it, that we try to minimize the extent to which they then become subject to this Movelang. And social media has been great in helping us be able to communicate and get more things out there, but regrettably, it has also been bad in the level of defamation, fake news, and demonization of persons. My friends, this country has to remain successful and stable, but it's not going to happen by serendipity. It's not going to happen because we wish it. It's going to happen when we make it happen. It's going to happen like a house that needs maintenance. If you don't actively wake up every morning and every month to do the maintenance, then you're going to see things happening. The paint starts to peel. When the paint starts to peel, the board underneath starts to become exposed to weather. When that happens, it's subject to rotting. We have to protect the society and the country that we have, and to protect the public space. Because if we don't have people protecting the public space, we will reduce ourselves to anarchy. And as it relates to the country, about people living here and working, let us remember who we are. From the 1850s, we have been exporting people to the rest of the world to do services, from Guyana, right back in the south, right back up to the North Atlantic countries. We have been the country that has shown the world that we can have people who can serve at all levels of global activity. How many people remember that Dame Nita Barrow was a member of the Eminent Persons Group, established to be able to help Nelson Mandela come out of prison? How many people remember that? But she didn't make her name in Barbados. She made her name internationally. She lived in Geneva for many years before coming back to be Governor General of Barbados. Sir Hugh Springer and Sir Kenneth Stewart similarly reached the top of their fields in education and public health, respectively. But where did they do it? Outside of Barbados. You heard me refer to Sir George Allen just now. He didn't make his name in Barbados, but he became Director General of the Pan American Health Organization. We also celebrated the life of Edward Kamau Brathwaite when he passed away from this world just the other day. But he did not make his name in Barbados. In fact, he started teaching like Courtney Blackman in Ghana, in Africa, before coming back to the Caribbean and serving at a very high level to become one of the world's preeminent poets. My friends, I could go on and talk about the people who went to London Transport. I could talk about the nurses that work in North America now and in the United Kingdom. I could talk about the doctors who have reached the top of their field. I could go on and on. Or the teachers in Cayman Islands and in the Northern Caribbean, or the policemen in Bermuda. I could go on and on and on. We are going down a very dangerous path if we believe that all wisdom, all knowledge, and all understanding is to be sourced and contained within this island of 21 by 14. We really are. And we're going down a very dangerous path if we believe that all of the skills needed in the country to undertake national agendas lies within the government, or even within the parliament, between government and opposition alone. And it is why I feel the need to have some of these conversations sometimes. That is why I take umbrage as well, my friends, to the criticism of our fast-tracking the housing provision exercise by bringing in 150 emergency homes. The government has embarked on a program to build thousands of homes. Yes, there will be a silent revolution in housing. But before we even got to start that silent revolution in a meaningful way, we had the storm, the freak storm, 46,000 strikes of lightning in 90 minutes. That is why I have to be at the special climate session with the UN Secretary General on Monday morning as I seek to open that consultation that will only have 35 heads of government from across the world. Because we know what it is firsthand now to be the victims of this climate crisis. But as we literally seek to house those Barbadians, and there are over 500 households that have to be completely rehoused in new housing, and there are just under 2,000 whose houses have to be repaired. So when you hear that we are bringing 150, do the mathematics, my people. How does it get the majority? And I met with you as well as the other members of my government on the day after Elsa. And we said to you, let us try to get as many of our people back into homes for Christmas. That's what you would want, that's what I would want. So that when we order these 150, it is because we don't believe we can do all on our own within the time frame in Barbados one time. And let us be clear, who you think is going to be building the foundations for these 150 houses that are coming as prefab structures from China? It is Barbadians that building the foundations. Who do you think that will be assembling the houses once to get here, the prefabricated parts? It is Barbadians who will be assembling the houses. And I go further. Anybody who has ever worked with this government knows that this government will always push the envelope. And we say to the country that we are in deep negotiation to have that same Chinese entity establish a manufacturing firm here that will see us producing those houses, not just for Barbados, but for export. But the bottom line is that when we ordered those houses last month, it was to help us meet the deficit with respect to the need for emergency housing against the backdrop of the worst hurricane in 66 years. First and worst. And I'm happy to report that I've been told by the Minister of Housing, that on Tuesday, September 21st, that is in 2 days' time, 3 days' time, that they shall be leaving the port in China, headed for Barbados. Now, what does that mean? This means that by possibly independence, some of these houses will be being assembled. And we're targeting that by December, as we had hoped when we spoke to you the day after Hurricane Elsa, that many of these houses, the ones being built locally and the ones that are coming in prefab to be assembled, will mean that a lot of the persons displaced from the hurricane and the storm will be back in homes rather than living in the less than ideal conditions that they are in this country. As recent as this week, the Ministry of People Empowerment put out an ad for temporary accommodation for some of them, because in some instances where they were trying to stay in the existing houses, the conditions are not conducive to them remaining there. I asked the majority of Barbadians, what's wrong with that? What is really wrong with that? We have to be able to meet the needs of our citizens as best we can. We do not produce everything that we need. We cannot. We do not have all of the services that we need. We cannot as a small state. And the fear of foreigners that is being fueled by a few cannot help us and cannot carry us anywhere. We have to recognize, my friends, that our National Population Commission report, and I said it over and over, shows that our workforce will be smaller in 13 years than it is now. That Barbados's number of workers will be less than it is now in 13 years. That is as a result of us not replacing our population for 40 years or more. We do need people. We need people from the diaspora. We do need services. Just as I've said, we've had to bring in the Cubans and the Ghanaians. And I look forward to meeting with the President of Ghana in one of the bilaterals in a few days' time. Just as I spoke to the President of Cuba last week. And in the interim, we may have equally, because you have to walk and chew, there is the distinct possibility that we may have to export some Bajan services to the world until we can have the level of economic recovery that we need. Just as we exported services in previous decades when we did not have all of the people being able to find the kinds of jobs that they needed in our country. And the export of services anyhow is part of our mantra and our strategic objective when we say global citizens, Barbadian roots. We have to recognize that our home can be that hub. And that hub means that people will come in and people will go out. But we will not have it if we have the kind of adversarial comment or abusing or demonization that a few people are doing. And what is the reality? I believe that the majority of Barbadians are accepting and grateful for the work that is being done by those who have come to help us here. But sometimes the voices of a few, amplified by the technology, may give others the impression that this is the dominant view. Well, we learned that the hard way in so many things. And indeed, those across the aisle also learned that the hard way when they felt that as they were in their own battles, as recent as last month, the voice that the public of Barbados saw and heard the most in the media was not the voice that won the election in George Street. And therefore, we have to remember to contextualize everything that we do. I know, my people, that we are wise and we are an intelligent people. And as we speak about cultural penetration, as many do in our societies, let us think and let us act wisely. Do not let us only import the negatives, but let us adapt to some of the positives as well. If you look around the world and see what is happening, if you want to Google and follow what is happening in America, Google and see that you can't get into a good restaurant, or any restaurant for that matter, in most places without a vaccination card. Google and see that over 70% of persons in Denmark, in Iceland, and in other countries that have started to open back up are vaccinated. Google and see that just as COVID is affecting Barbados' ability to provide several of the social and infrastructural projects that we need to do, the same is happening in other parts of the world. And what do I mean? We have gone recently for $47 million for a supplementary for the Ministry of Health. This week again, I had to sign off on another $12 million in expenditure in order to keep ahead of the curve, so that when Dr. Ford and others say to you, come early, because the earlier you come, the better we can treat you, the more we can save your lives. And 4 of the 6 persons who died this week presented too late. But if Bajans come forward early, we can save your lives. Now, I can say it as many times as I want, but it is up to you, my friend, to accept that. It is up to you to know that if you're having diarrhea, get checked and get tested. That if you're feeling the coughing in your throat and the other things, or you've lost the taste in your mouth, don't wait until you start to feel bad. And there's something that I'm going to do outside of government. And that is that I want more Barbadians to be able to use the oximeters that to test how much oxygen in your blood. Because I'm not a doctor, but from just being around the doctors recently, I learned clearly that that is one of the key measurements. And regrettably, I learned it with my brother's own death from sepsis. That is one of the things that if we can measure and be able to get to people before their oxygen sats drop too low, that you give the doctors and nurses a chance to save you. But the only body who can know that you're feeling bad is you. And if you don't tell anybody, we're not going to know it by osmosis. Not at all. We need to hear it from you. And in that respect, therefore, if I can get some oximeters and distribute as I want to, separate from you, Jeffrey, I will try to be able to see if we can do what we can do to get them in a number of households across this country, so that people with the correct tutelage, training, instructions will know that something not quite here. Up to last weekend, I had to intervene with somebody who was hoping and said they're feeling bad at home. And as God would help him, once he was seen by the doctors, he was perilously close to being in a situation that would have been critical. And even with that, he still had to face intensive care treatment. So my friends, when I tell you, don't just Google about the conspiracy theories. Google and see what is happening in every other country around the region. And know, as I said, that the death toll generally, not just in the region but globally, is staggeringly higher than that in Barbados. And I say this not as a boast at all. I say this as an act of encouragement for us to continue resolute on the policy directions that we're going in, but secondly, also as an encouragement to those of you who can help us by protecting yourself, by taking the vaccination. It is not me that has constructed these facts. The reality is all 6 persons that have passed this week, and the few that passed since Delta, all without exception have been unvaccinated. And that is why I said to you 3 weeks ago or 4 weeks ago that this is now proven to be a pandemic of the unvaccinated. And I maintain that because the evidence is clear not just in Barbados, but across the world. But equally, you have already voted that way with your feet by coming forward. So let us cease and settle, because more Barbadians have come forward in the last few weeks, recognizing that they too want to ensure that should they be the victim of catching COVID, that the chances, overwhelming chances are that they will survive it, that they will not die, and that they will not have serious illness. There is a small percentage, Dr. Ford keeps reminding us, of 7% who are likely to have the breakthrough cases among the vaccinated people. But if we catch them early as well, we can ensure that none of them go the way of the others who regrettably have gone to the great beyond. So, in summary, yes, we are inching along nicely, but we need to finish it quickly. We have to better protect ourselves. We need at least another 50,000 persons vaccinated. We will not reach there in one jump, but we will do so day by day and week by week. But I want to say to Barbadians, let us agree to simple targets. Let us agree to aim to get as close to 10,000 persons per week being vaccinated. We're now just under 6,500, I think, a week. So I'm asking to go a little harder. You know, when you go to the gym and they tell you, okay, you're at 12, just give me a little extra to get to 15. Just give me that little extra to get to 15. Well, we're at 6,500, well, give me that little extra to get to 10,000. And if we can do that, and we can maintain that each week for the next 5 weeks, then we will have the majority of those persons fully vaccinated before the end of November, before Independence Day and Christmas, such that we may, as a country, consider then the options of significant review and removal of restrictions that we have in place. We will still have to wear the mask, we will still have to sanitize, and we will still have to watch our density and to do physical distancing. But if we can move 10,000 people per week in each of the next 5 weeks, there will then be a clear and justifiable case for the government to take to the doctors and the public health specialists that will allow us to gradually remove the restrictions, even as we count these weeks, such that, as I said, by the end of November, there would be no more restrictions for us to remove. And what do I mean by that? If in the next week, for example, we can see 10,000 people being vaccinated, then there is a clear case to review the measures and to be able to review the hours for curfew and to push it back later, whether it is from 9 to 10 and remove it from 6 to 10 on Sundays. And that's the kind of conversation that I want us to have, because it is important that you understand what is the criteria that we are considering as we meet with the public health specialists and the doctors and the EOC in terms of where we go. So, are we locking down? No. I've said to you before, we're not locking down because we don't believe that we can continuously lock down in a marathon. Did we slow down? Yes, we did. But I told you we were slowing down in order to increase the number of persons being vaccinated. That has happened. But we need to do and push a little harder. Not because we can't take our time, we can, but more people will be exposed. But if we do it week by week, 10,000 a week for the next 5 weeks, then we, my friends, have it within our power to remove a lot of these restrictions, to be able to remove and reduce initially and ultimately remove even the curfew hours. Will we get all? Possibly not. But we don't want any more needless deaths. And we want to be able to reach a situation, hopefully by the end of November, by Christmas, that we treat to this COVID as we do to chicken pox, as we do to dengue, as we do to the flu. Yes, regrettably, they still kill a few people among us. And those are people who are particularly compromised with the medical conditions or the comorbidities that they do have. But for the most part, they don't. And we can continue to do the things that we want to do. As we did last night at about 9:30, I felt like eating popcorn, but I couldn't go anywhere and buy because the curfew was on. And there's some of you who may get hungry at night too and want to go and buy something. And by Christmas, I want you and you want to be able to do it too. But we can get there because we've done well, we've done better than most. But we need to close the gap now. And we need to dig deep and breathe and let us do it. So let's cut out the resistance. Let us stop intellectualizing what should be a common sense thing. And when I meet and talk to you one-on-one, that's what you're telling me. Hundreds of people, millions of people, around the world cannot be wrong. And we look and see what is happening with those who literally have vaccinated and the extent to which the deaths that are occurring across the world are predominantly among the unvaccinated. This is one of the points that I will be making next week Friday at the United Nations, but I wanted to start by making it to you today. Let us be wise and preserve ourselves and those who we love and those who we care for. But in particular, let us recognize that the people under 12 cannot yet do it. We are awaiting the guidance, but at this point in time, they cannot yet do it. And the one thing I know, whether it is older people, whether it is mothers and fathers, whether it is uncles and aunts, whether it is neighbors, whether it is men on the block, regardless of who it is, we all love and want to protect our children. And we all love and want to protect those who raised us. Those are the two vulnerable groups, the very young and the very old. And it is up to those of us who can lift weight to lift weight and make many hands light work. I want also, however, before finishing, to address just one or two other matters that I believe to be important. There's been much discussion as we move along towards the election of a Barbadian head of state as our head of state going forward. I'm happy to report to the country that we will in fact be laying the legislation for that on Monday and giving notice to the House of Assembly of it on Monday. And on Tuesday, the Attorney General will move the first reading. First reading is just a process in Parliament, but the actual debate will not take place till the following week when it is then the second and third reading and full debate. That legislation is simply about what is necessary. One, to ensure that we revoke the Independence Order in Council that was done by Her Majesty the Queen, and make sure that what is left with the Barbadian Constitution is simply a Barbadian Constitution anchored by the Parliament of Barbados and not anchored by the actions of Her Majesty in 1966. It does not in any way change any major thing other than it provides as well for the election of a Barbadian head of state. And it sets out the procedure as to how it will be done and whether and how she will be nominated and how or he may be nominated, but in this case you know what I've signaled to you already, and how going forward the process of Parliament with respect to how that process is completed. It's very straightforward. It's a simple 2/3 majority of each house, whether it is the House of Assembly or the Senate. Each of them must vote in their own deliberate right, and it sets out, for example, how the nomination is to take place, what happens when it takes place, and how the election is to take place. Other than that, the rejection of the Order in Council of Her Majesty requires that we simply save the Constitution, and that is done very clearly at Clause 5, but it also saves all of the powers and privileges and offices and commissions that we have now in the country. And the last thing that it does is that it changes the oath of office, so that instead of having an oath of allegiance to Her Majesty the Queen, it will be an oath of allegiance to the state of Barbados. That process, as I said, therefore, will start next week, and we will continue to explain and to ensure that you understand exactly where it goes. I want to give the assurance to those persons, as I've done before, there will be no major change to our Constitution without consultation. And that is why we have said that the consultation will start in January, and it will be chapter by chapter. And it will be the subject of extensive consultations, just as we did with the Thorne Commission, that consulted for more than a year up and down the length of Barbados on the issue of local governance. We also expect that the Cheltenham Commission on Parliamentary Reform will start working before the end of the year, but it too will feed into that consultation on the new chapters in the Constitution that we will bring. And that is why we believe that the level of consultation will take about 12 months with respect to the kind of new constitution that the people of this nation want in its first deliberate act of after having elected a Barbadian head of state as president. We've spent a lot of time, my friends, since coming to office, talking to people and consulting across the length and breadth of this country, rubbing shoulders. Indeed, in the last 4 weeks or so, I've spent a lot of time even meeting with people sectorally, because we've said that we prefer not to mandate, and that therefore we want to talk with people to ensure that we understand where people's heads are and what it is they want to see as we go forward with respect to expanding the vaccination program and doing the other things. I expect as well that Sandhya Bradshaw, Minister of Education, will speak to the country with a roadmap with respect to what it will take for us to resume face-to-face classes in this country, because as I've said to you over and over, one of my greatest regrets has been the impact that this has had on our children with respect to the educational opportunities as a result of this awful pandemic, being deprived of them because of the steps that we've had to take to protect the entire nation. Next week, on Monday, we will also be given notice and moving for first reading before Parliament new things that were promised. And I use this opportunity to share them with you. We will be replacing the 1925 Prevention of Corruption legislation with new legislation drafted for 2021, a new anti-corruption bill 2021, which will go before the Parliament as we promised to do. In addition, we will also lay for the first time the Remediation Agreements Deferred Prosecutions Bill of 2021, empowering the Director of Public Prosecutions to meet with and to be able to construct agreements with respect to criminal liability or opportunities for prosecution with respect to persons who have been guilty of acts. The Attorney General has also indicated to us that he will shortly be bringing to Cabinet and Parliament the revised Integrity and Public Life Bill, such that we may reintroduce it into this new session of Parliament, and I hope as early as October, to ensure that the concerns expressed by the Senate will be addressed by this new bill. For those who may ask, how can we do so when that bill was rejected by a Parliament since the last election? Well, you will remember that we had a prorogation of Parliament, and therefore technically we are in a new session of Parliament since September last year, and therefore the rules of the House allow us to bring back the bill so that we can pass the Integrity in Public Life Bill. Might I remind you that I was very clear when ministers were sworn in to ensure that the Cabinet Secretary took also declarations of assets from each and every Minister of the Crown to ensure that those are there until such time as there's a functioning Integrity in Commission gathering and governing under the Integrity in Public Life legislation that is to come. My friends, I've spent a long time this afternoon updating you on a few matters. With respect to the cost of living issues, that matter is still before the Subcommittee of Social Partnership, and I really do hope that early in October we will be able to address that and continue to expand on our housing program. I've spoken a little bit about it today. but we will speak more. As I go to New York, as I said, for the UN General Assembly, there will also be a number of serious bilaterals meetings. We will be dealing with climate, we will be dealing with pandemic, we will be dealing with matters pertaining to access to financing and the creation of more fiscal and policy space for small island developing states. Those meetings will not just be with heads of state or heads of government, they will also be with heads of international organizations, from the United Nations Secretary General, the World Trade Organization Director General, the head of the IMF, the head of the World Bank, and a number of other key entities. I have not had the opportunity for face-to-face encounter with a lot of these persons. Indeed, I have not left the country since March last year for just, 18, 19 months. And therefore, I've tried to condense and to add as many meetings as possible within the short period of time, including, I must add, hopefully a meeting with representatives of the Barbados Registered Nurses Association in New York and other members of the diaspora, because we want to be able to engage them fully in this battle that we have at home, as we've said from here in Bridgetown. And in spite of being away, well, technology is here. So we will remain in contact with Barbadians day to day as we continue to go through these challenging times. But I have full confidence in Jeffrey Bostic as Minister of Health to continue leading the battle. And as usual, Santia Bradshaw will hold the fort, acting as Prime Minister for me during my absence. I will be back by next Saturday night or Sunday morning, I think late Saturday night, early Sunday morning, and I leave tomorrow. But I felt that it was important to share with you and to be able to contextualize a number of things that are of concern to me, given what has happened during the course of this week. And then to also contextualize things that the government is proceeding with as we go forward, because we are on the right track. The road is rough. As I said, if you want to use the metaphor of the sea is choppy. And yes, the new word I coined last time, roughy. But with the right strokes, whether it is dog paddle, whether it is freestyle, whether it is breaststroke, whether it is whatever you want to do to be able to try and keep your head above water, we are moving in the right direction. I'm happy to report that we continue to see more and more interest in investment and more commitment to having investments that were put on pause in the early days of COVID resume. But there will be another day for me to discuss all of those things with you. For now, we are close to the targets, and we can have a different world. It may not be the same normal that we knew before, but we can get back control over some of our movements. We can get back control over some of the things that we're doing. But to do so, we have to make sure that the majority of the country is safe. And what are the objectives for that? We know we cannot remove COVID from our landscape. No part of the world can. Not unless we want to go to Mars or Pluto. We can't. But what we can do is reduce the number of deaths and keep them low. And what we can do is reduce the number and level of serious hospitalization. And that is why we ask you, let us hit a target of 10,000 a week for the next 5 weeks so that we can see a better future post-November 30th. Let us hit also a target of asking each other in our homes, in our communities, to just not drop your guard when you're around each other, because you can't assume that somebody who you know well is not necessarily the one who is going to infect you. And let us, above all else, treat each other with the empathy and the compassion, and not to demonize and denigrate people, especially those who are helping us to keep our heads above water. And above all else, if you're feeling bad, tell us. Let somebody know. Because we know that the chances of keeping you alive are so much greater if you can get into the system early. And Dr. Ford, Dr. Hassel, Dr. Lovell, and the wonderful team of doctors there can help. But separate from them, I'm already working also with the Queen Elizabeth Hospital, because I'm deeply conscious that COVID has made it more difficult for a number of you who have diabetes and hypertension and kidney problems and all other kinds of problems that you had before COVID, just as the country had economic difficulties before COVID. And we are learning, however, to see how we can make life easier and better for you. And that is all that we ask. This is a partnership. We are a people of faith, but faith without works means nothing. I ask us, therefore, today to set these simple targets and to let us work together in faith, in transparency, but above all else, with perseverance, commitment, and dedication to meeting it. Each one, reach one, and we shall hopefully end 2021 better than we started it. Thank you, and God bless this nation, and God bless Barbados.
And thank you very much, Prime Minister, the Honourable Mia Amor Mottley, and the Minister of Health and Wellness, Lieutenant Colonel, the Honourable Jeffrey Bostic. Good afternoon.